Welcome everybody to another episode of The Pelvic Detective. My name is Ingrid Harm Hernandez. By now you know that I'm partnering with Desert Harvest for a series of videos on pelvic health. For this month, we are doing a special video on breast cancer awareness. And a lot of you might say, well, what does pelvic health have to do with breast cancer? But the fact that that's a question is exactly why this video is so needed. So what I mean by that is a lot of pelvic conditions occur during the time period during and after breast cancer treatment, but the focus is on the breast cancer treatment itself, which is, obvious and should be. However, pelvic health issues, which are very common, are often then ignored or they're seen very late or discussed very late. So I kind of want to change that a little bit. And there are systems out there, hospital systems, who do see their patients through that whole breast cancer treatment time period for pelvic floor issues as well. So it's on the road to improving, but we need to pay a lot more attention to it. So you might ask, what are some of those common conditions that you see during breast cancer survivor time period? They include pain with sex, pain with tampon insertion, overall pelvic pains. That means anywhere in the pelvic area, hips, back, that all can occur during this time period. Constipation can occur during this time period. And there is something called lymphedema, swelling of an arm after cancer treatment as well, but we're going to focus on the pelvic floor issues for today. So these conditions are really common, as I mentioned before. In fact, there was a publication in July of 2022 by Columbus who showed that 80% of cancer survivors, breast cancer survivors, had urinary incontinence, 20% had fecal incontinence, and 67% had some kind of sexual dysfunction that was occurring during this time period. But because the great lack of just understanding and knowledge in this area, patients just weren't referred to pelvic PT, where a lot of these conditions can be taken care of. So you might ask, well, why are these particular patients at such a high risk for these conditions? Well, one is that medication that breast cancer survivors are given can change the entire estrogen and progesterone level, so the hormonal levels in the body. And those hormones help also keep our muscle and tissue health going. So when you're disrupting that, the muscles and tissues can be badly affected by it. And what that means is that you can get a reduction in sex drive. You can get vaginal dryness or dryness of the tissues. The pelvic floor can suffer from weakness and difficulty functioning the way it should. So that then in turn leads to urinary incontinence, fecal incontinence, pelvic pain, pain with sex. So you can see that there's this tie-in because of the medication, that there are changes that make these pelvic conditions happen. So there's also usually a reduction in overall physical activity during cancer treatment, and that itself can compound some of these weaknesses and changes in muscle tissue, and especially at the pelvic floor. To compound it even further, because it takes longer for patients to get to pelvic PT, the symptoms can over time get worse and worse, like many conditions that include the musculoskeletal system. Just lack of treatment can make those muscles get tighter, weaker. So in other words, they increase the likelihood of these symptoms happening, or even if they are happening, make them worse. So an increase in awareness of these conditions for you or your loved one can get someone that care much sooner. So it's easier to take care of the problem, and it's easier to change things that are happening in the body. So I would say right now you want to make sure that you reach out to your oncologist, to your OBGYN, to your family member, whoever needs to make this problem happen or improve faster is who you need to reach out to. So please do that. A pelvic PT is the perfect resource to make these problems get better. So these conditions can be improved by a pelvic PT's care. So they can instruct you on everything on tissue health, on dilator use, on pelvic floor exercises, and just techniques that can help you get through all of these different things that you can help yourself, right? Pelvic PTs empower you to take care of yourself, especially at a time period where so many things are going on, right? So I would say right now, one of the best things you can do is, again, reach out to that pelvic PT and realize that there are other resources like Desert Harvest out there that have wonderful products that can really help you get through this time period. So lubricants and moisturizer and pelvic wands and dilators, all the kinds of things that help these conditions get better. In fact, we're going to do a great interview with Heather Florio, the CEO of Desert Harvest, to give you a little more idea of some of the great things for both breast cancer itself and for the pelvic floor that can help you get through this time period and really resolve those issues. So stay tuned for that. Also realize that my book, The Musculoskeletal Mystery, How to Solve Your Pelvic Floor Symptoms, is a great partner to all of this, explains a lot of these things we just talked about in detail, and helps you find your pelvic PT, helps you find the other practitioners that can help you get through this. So please look at the book to get all that wonderful information, and stay tuned for an interview with Heather Florio. Looking forward to seeing you again in a future episode of The Pelvic Detective.